Hello everyone. Today I'm going to be talking about strategic management in the COVID-19 crisis. I do want to first apologize for my appearance. I did just get out of the hospital. I had hip surgery a few days ago, so I'm not looking my best. I know I'm not looking professional, so please don't judge me on that part. But other than that, let's go ahead and get started. So the United States has been under siege with major strategic policy changes due to the worldwide pandemic of the COVID-19. Government and world leaders have faced daily challenges to help prevent the spread among their citizens. Guidelines are always changing and evolving at the local, state, and federal levels as new medical information becomes available to them. Since the protocols and procedures are fluid and could alter the tactics, the U.S. government has to develop a strategic approach to provide their citizens with the safest and most effective way to counteract infection rates. The government's currently using the 4 steps: formulation, implementation, evaluation, and modification to slow the spread of this deadly virus. So the process of strategic management has 4 steps. Step 1 is formulation. Just simple form a plan that's going to help you to successfully achieve your goal. Step 2 is implementation. So just put that plan into action. Step 3 is evaluation. Evaluate your plan, see if there's room for improvement, and modification. Make changes to your original plan to make it more successful. Our first step is formulation. With COVID-19, the government was forced to think fast and on their feet. The virus was spreading like wildfire and they needed to form a plan to stop it. So their initial thoughts and plans included stopping all international flights. They didn't want anyone going in or coming out of the United States. They stopped the people that were coming back in from the U.S. I know that the Princess cruise ship had difficulty getting back into the United States, getting access, but a lot of the people were getting really sick and starting to show symptoms of the virus. So as soon as those people got into the country, they were immediately quarantined. Social distancing was where they started from the beginning to keep everyone 6 feet away from each other. Don't get any closer than 6 feet to someone. And they also stopped visitations to jails, prisons, and nursing homes because the elderly were at very high risk of getting this virus. Now it's time to implement the plan that they put into place. Stopping all flights. Those were no more flights. The flights had come to a screeching halt, and people were allowed in. The ones that were allowed in, of course, like I told you, were on a mandatory 14-day quarantine. People who already tested positive were being quarantined, of course, and social distancing became our new norm. After the implementation of the plan that they put into place, on March 11th was when Trump declared this a national pandemic. And that is when we ran out of toilet paper. It happened. I'm sure you saw it everywhere on social media. I'm sure you heard about it. But apparently we were very, very worried about our toilet paper, and you could not find any anywhere. People were emptying the shelves of everything though, so I mean, toilet paper was just the first to go, and quite frankly it was kind of comical. There was also a massive shortage of Lysol, which you still can't find today, and hand sanitizer. That was something that went very quickly. Everyone was very quick to be cleanly and disinfect stuff as soon as this virus hit. PPE equipment was another thing that we were very short on, which was frontline workers were struggling to find enough gloves, masks, and things like that to keep them safe. And later there would be a national shortage of ventilators to keep people breathing, the ones that were sick, and I mean, even the ones that didn't have COVID but needed a ventilator. It became very sad. It was time to evaluate the plan that they had put into action. By this time, Trump had put in a 15-day stay-at-home order. Social distancing was being practiced all over the country, and flights were at a stop. There was no flights coming in or going out of the country. With the stay-at-home order, citizens were ordered to stay at home unless they were going to get groceries, anything essential basically, or going to work. Although this would change later to only be essential workers because all businesses were closed. Although this was being enforced, the number of cases were at an all-time high. So the government and public administrators had to do more. They knew that they needed to make changes to slow the spread or stop it entirely. Since the numbers were still rising rapidly, President Trump, as well as state and public administrators, evaluated what needed to change. When Trump made the announcement about the national pandemic on March 11th, most schools were already on spring break or about to be on spring break. So they just extended that a little bit and said, we'll just write it out and see what happens. Hopefully this thing goes away and it doesn't get out of hand like it did in China, but that wasn't the case. They knew that, and after the kids had been out of school for 2 or 3 weeks, they finally decided to go ahead and make it a virtual learning environment, and they canceled school altogether. Baseball and other major league sports were canceled until further notice. The entire MLB baseball season was canceled, which my husband was very upset about, by the way. Yeah, this is the first time that any of that has ever happened in our history. And large gatherings of more than 10 people were not allowed. They decided it would be beneficial to extend the stay-at-home order for a little bit longer. So this stay-at-home order was going to last into the end of April, which I believe that it got extended again after that, but I could be wrong. So in continuing on the modification, hospitals were running out of PPE equipment just because of the high numbers in New York, New Jersey, and Washington. So the citizens came together and started making homemade masks and PPE equipment. They were making them out of cloth and anything else that they could find, other materials. This was just in order to keep our frontline workers safe and the people who were essential workers and had to get out every day. Alcohol distilleries and other manufacturers stopped making their original products and started making PPE equipment and hand sanitizer. That is how bad it got. The other changes that they made to their original plan included closing bars, gyms, and restaurants. All non-essential businesses were ordered to close until further notice, which caused a huge increase in unemployment rates. And that is why we got a stimulus check, or a lot of us did. Children weren't going back to school, sports were canceled, they closed Las Vegas. The entire Las Vegas Strip was closed down. They closed down all the big casinos, restaurants, bars, everything for over 30 days. And people were now forced to wear face masks in the public. So you can see the changes are ever evolving every day. They're changing. This had a lot of effects on public administration. Frontline workers were forced to change their daily work routine and how they treat their patients. Government officials had to put new policies into place when the country shut down. The way that we receive goods that are delivered have changed. Most places of business now have a contactless drive-through or a way to give citizens their goods without coming in contact with one another. And unemployment rates are at an all-time high. So it affected public administration in every way that you could imagine. So COVID-19, it came in fast and hit hard. With the endless work of our public administrators and government officials, we're now living in our new norm. We have all had to find new ways to cope with this different way of life. The financial impact will unfortunately last for, I would assume, decades, but we'll continue to fight this battle together. It's my belief that we'll never go back to life before 2020, but we will learn to live with COVID-19. The world of public administration has and will always be forever changed. Thanks, guys. Y'all have a great day.